We first visited with the Ross County Health District in mid-March to talk about the upcoming pandemic and its increasing numbers from COVID-19. Well, now, nearly a month later, we give you another update. Visiting in just a moment with Ben Avery, administrator of the Ross County Health District, and the Health Commissioner, Dr. Christopher Brown. That's just ahead. First, this from Hometown Motors Incorporated, 818 Eastern Avenue in Chillicothe. Husqvarna handhelds, chainsaws, trimmers, leaf blowers, hedge trimmers, and more. Buy it here, get it serviced here. Hometown Motors Incorporated, 818 Eastern Avenue, Chillicothe. We want to really give folks an update. We've not talked for about 12 days or so. So we are seeing that the cases continue to increase here in Ross County. And that being said, it's something that we were expecting and projecting in the early numbers.
Yeah, I don't think we're at all surprised where we are right now with 20 positive cases. I think this is kind of in line with what we're expecting. We're seeing a steady increase in cases here in Ross County.
And we don't know what to expect, but we do know that we're seeing that social distancing appears to be working because the numbers are much lower than what were projected 2-3 weeks ago.
Yeah, so it seems that it does seem to be working. Ross County as well as across Ohio, those numbers are definitely lower than what the models projected.
Yeah, models make it very difficult for everybody. We've seen that across the state, but it's great to know that the things that we have put into practice are showing signs that they're working.
Exactly.
Yeah, I think it's important to point out that it's not like our projections were off. It's our behaviors that that the governor and Dr. Acton have been telling us to do by staying home and social distancing. That's what has driven those numbers down.
One of the things that we wanted to touch on, and especially with you, Dr. Brown, because we know that there's been so much push and drive. Hey, we're starting to be better. We're disciplining ourselves and how we do things. So when the stay-at-home order expires at midnight on May 1st, unless the governor extends this again, what does May 2nd start to look like for us?
That's a very good question. So we actually have the last couple of days, actually at the health district, we've actually been kind of having those very conversations as to what life looks like out, once the stay-at-home orders are lifted. First of all, I think people have probably heard this in other media outlets. I don't know that we're going to return back to normal the way people probably think. What will probably happen is that if the stay-at-home orders are lifted, it's probably going to be more of a reduction, where they kind of like they layered it on. They're probably going to layer it off. The thing that people have to remember is that the virus is not gone. The virus. We don't have a vaccine. We still don't have a treatment for it. However, we have controlled that curve. We flattened that curve. And since we've done that, like I said, we may be able to, enjoy a few more of our liberties than we've been enjoying over the last few weeks. However, we won't be able to just go back to the gatherings and things of nature like we had before, because if you do, then what you have is what they call a rebound on the back end. So like I said, you run the risk of that curve going back up steeply, and you being kind of back in where you were before. So my kind of gestalt, or just kind of, gut feeling is that it's probably going to be, kind of a slow lifting of certain restrictions, and then kind of following the numbers and kind of going forth like that is what I would think would happen.
Yeah, I agree with that. I agree with that. I think that there's going to be like limited freedom, so to speak. So, for example, you may be able to go back out to your favorite stores, but there could be a requirement that everybody that enters the store has a face mask, and that every employee in the store would be wearing a face mask, and you're still maintaining social distances in those stores. It's hard to say what exactly it's going to look like, but it'll probably be, limited access based on certain provisions such as that.
I know many of the facilities we go into these days have posted signage on their doors as you enter in, perhaps 3 questions. How do you feel today? Have you taken your temperature? That sort of thing. Um, will we ever see, and I know we asked last time we got together, will we see someplace like Kroger who has their own pharmacists, maybe someone standing out front taking our temperature before we head into a building?
Um, I don't know that we'll get to that point, unless, like I said, the numbers really do bounce. But I do think you may get situations where, like I said, they either have masks available and definitely probably hand sanitizer available whenever you come in. The grocery stores even now have wipes that you can wipe down the baskets with. And I actually had to go to a store this weekend. Granted, it was up in Columbus, and they literally spray. They offered hand sanitizer where you spray your hands as you come in to get them clean. And so I imagine there's going to be a lot of that, a lot of good public health preventative measures that are kind of pushed as you enter the buildings. Because the overall public health message is still going to be that if you feel bad or if you are at risk, we still don't want you out in the public. So, whereas, Kroger itself may not ask you to do that, we as a health district are going to be asking the public to continue to not go out into the public if you have symptoms.
Ben, you want to comment on that as well?
I think Dr. Brown covered it pretty well. It's going to be, we're still going to have to be hyper vigilant about the decisions that we make, because we understand that what we do can affect other people in ways that we can't even comprehend. So,
I think one of the more impressive demonstrations in video released recently by the Ohio Department of Health about space and the difference that it's making. I don't know if you've seen it yet or not, but it shows a number of objects all together, and then suddenly there's just one, like the moon is all you see. So the space is what they're getting to create space between each other, and we're seeing everything kind of go away. But we could get back to normal if we had a vaccine, right?
I guess if we had a vaccine that works. So you got two components there. So you got the issue of the vaccine, and it looks like most places I've seen says it takes anywhere from 12 to 18 months before you have a working vaccine. So you'd be talking more in the January, February of 2021 at the earliest. So, I don't think we want to stay on lockdown, until next year. And then, the question is going to be how effective the vaccine is. Even with us doing the flu shots, a lot of times, some years we have great coverage, and other years is not that great. So, and we're not sure exactly what that would look like. And, say that we had a vaccine, we had a lot of people take it, but it was not a great vaccine. Would we still need to do, stay up, if it's really this bad, would we need to repeat? Maybe not quite on this level, but would we need to repeat some of the restrictions that we're seeing now?
I think the thing that's going to give folks confidence to go back out there is, the availability of rapid testing, so we can test more people in a very easy fashion, such that people have valid results, that they know that they either don't have the virus at this time, or there's other tests that are going to tell folks whether they've contracted it in the past. So that would be helpful information as well to be armed with before we go out in the public.
Speaking of testing, nearly 200 people have been tested here in Ross County now, and a high percentage of that has come back negative, and I think that's important to note.
Right. I think it's over 10% at this point. Maybe roughly 1 out of 10 folks that have gotten tested have been positive. And you have to keep in mind that these aren't just random samples of people. These are individuals that are showing symptoms of COVID-19 that have been tested. So even 1 in 10 out of those actually show up with having the virus.
I'm sorry, Ben, if I could have you address the Chillicothe correctional and Ross County correctional population. I know that becomes a concern mostly because of the Pickaway County Correctional Facility, which yesterday they announced to have 60 cases, one death, of course. But here locally, we've not run into anything just as yet.
No, we don't have any reports of prisoners testing positive at this point here in Ross County. If that were to happen, it can kind of skew our data a little bit, because when those prisoners are tested positive, the prison system manages those cases, and if necessary, has agreements with hospitals in Columbus for treatment. So that's something we're going to have to keep our eye on here and communicate accurately if that were to happen. What we would be interested in, though, is the prison guards that eventually test positive and live in this community, that we'll have to do the full contact tracing and quarantine and isolation of those individuals.
Anything we've not touched on you wanted to make sure the public knew?
I mean, I think that, overall, like I said, it does look like we've done a very good job, both on a local level as well as state level. I think that the next step, if we're going to take that next step, is going to require, significant coordination between, actually significant coordination, probably led by a lot of the health departments and districts around the state. Because, it's going to be a matter of, from a policy standpoint, kind of lifting up some of the restrictions, but we also have to make sure we don't overwhelm the healthcare systems that are in in whether it's Ross County or any other counties. So I think it's going to be a lot of coordination there. And I just ask people to still be patient, because, this is going to be, this is the first time for everybody. And so we got to see how this is going to look as we peel back some of those restrictions.
Yeah, I think the governor has, he's already kind of set the example in that he's using the experts to base his decisions off of. And up to this point, he's been fairly conservative. So we got to understand that as we look to whatever this next transition is. But I think that's the best indication of where we are headed, is by tuning in at 2:00 every day and listening to him and Dr. Acton speak. They're all often giving us clues as to the direction that we're heading and what the next steps might be.
If you've been watching this with us all the way through to the end, it is April 14th. So some of the dated information we have mentioned here may have already passed, whichever the case may be. But again, that's where we stand at this point in time. More details at rosscountyhealth.org is your website. And of course, you can always go to odh.ohio.gov for additional information. Gentlemen, thank you for your time, and thank you for your efforts in helping us through this pandemic.
Thank you for having us on.